Good morning. Good morning. You're welcome to our today's class. We are still on the course PhD 201, Primary Healthcare. Give me marker. Thank you. What's that? What did she say? Okay, leave it, leave it. Leave it. I want to know when it goes off. It's funny. You realize sometimes it will get weak. When the battery is when it's down, it will just go off. I will be talking to yourself. You're not doing like this. Nobody will hear what you're saying again. Yes, yes, I'm seeing myself. Don't worry. Good woman. She's a good woman. What's her name again? Eh? Rachel. All right, so Super D, Super D, go there.
Yeah, it's not market square.
She will look like a box herself.
Very well, sir.
Uh,
I'm very ready.
do you go to gym?
Yes, sir. Of course I do.
All right, all right. So let's continue. Give me marker. Okay, sorry. So let's look at the course PSC 201, Primary Health Care. Where did you stop in our last class? Huh? You say what? Supportive role. Come. Are you my student? My new student. Okay, she's my new student. You know who my new students are? Eh? Anybody I meet for the first time is my new student. So are you my new student? So you're my student. So you are my new student. And you are going out already. Huh? Good, good. So we are still discussing. Are we done with the tiers of healthcare? Okay, we go to primary healthcare. Okay, thank you. So actually, did you stop in the supportive role? Is that where we stop? Okay. So we'll be talking about rules. What role of what primary health care, but we are discussing it with respect to Nigeria health what system, right? That one of the KPI, the first one is what? Immunization coverage. If immunization is well covered in a particular area, you will know that the PHC is doing well. True or false? Next one is maternal and child mortality rates. 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 It's good. It should what? Reduce. So if all the time you keep hearing one woman went to give birth, she died. Immediately after giving birth, he died. I will like, what's going on here? True or false? The first question mark is what's going on? PAC Alpha, what's happening? Something going on. You come to a particular community, villages, people are dying, mother is dying. It's either they die before giving birth or doing the delivery or after delivery. PAC, what's going on? True or false? Yes. So it's also a key performance indicator. The third one is disease incidence and prevalence. Disease incidence and what? Prevalence. Disease incidence and what? I write it. Prevalence. Disease incidence and what? Prevalence. Okay. By incidence means that PAC is supposed to help to prevent. True or false? By teaching people, doing health what? Promotion. True or false? By doing health what? Promotion. Telling people about their health to guide their what? Health. So if the disease presence is much in a particular place, that means PAC is not doing their work. True or false? Yes. That will be the first question to ask. Don't they go for acting? What's going on? Then if eventually it occurs and prevail, the prevalence is more. It's also that they are not doing what? Because they should help to do what? Look for a way to curb it. True or false? True or false? So that's why if disease incidence and prevalence is high, they're high, PAC is not doing their work. True or false? But if they are low, as the day goes by, they keep going down. PAC is what? Working. So it's a key in the performance indicator. The next one is what? Patient what? Satisfaction. Patient what? Satisfaction. Patient what? Satisfaction. Even though this one doesn't concern PAC alone. Hope you know. You can have that in other tiers. True or false? True or false? But if the patients are not satisfied, especially those that are supposed to go to what? PAC. Of course, I told you that PAC is the first contact. Everybody is first. Before, by right, anybody that finds himself in a secondary healthcare setting must have gone through what? PAC. That's what it should be. You cannot just jump, boom. But you know now, where things are not done the right way, what do? Am I communicating? So it is assumed that those going to secondary or even getting to tertiary must have gone there. So when they are not satisfied, it's a problem. It shows that something that that's what they're not doing right. Am I communicating? Yes. It shows they're not. And how is patient satisfaction measured? How is it measured? Well, another one is through their health outcome. If what you tend to achieve, you're having headache, what you want, the therapeutic outcome you want is that headache should go. True or false? True or false? The therapeutic outcome you want is that the headache should do what? Go. So after visiting PAC, for example, and your headache refused to go, will you be satisfied? No. Will you be satisfied? No. Good. You will not be satisfied. So PAC they're not doing their work. True or false? Then another angle. After visiting the PAC and your headache, your headache left you, right? Disappeared. But you paid heavily. Will you still be happy? No. you will not be satisfied. True or false? You will not be happy. You'll be like, the money I would have used to feed my children as they've gone. True or false? The money is gone. True or false? You will not be what? Satisfied. Even though, yeah, headache has gone. That's why they have what's called DRF there. Drug revolving what? Fund, to ensure that patients get what they need at the minimal what? Cost, that will not tear their what? Pockets. Am I communicating? That's why they also go for essential medicines at that level, to ensure that the medicine they have, they're not like they have no business with brands. They have business with what? Generics. Those ones that will still do the work well, but at a cost-effective what? They will get it less costly, at the same time it will achieve its purpose. Do you know what I mean by cost effectiveness? You may come to pharmacy or PHC, whatever it is, and end up treating malaria. They've confirmed that you have malaria, and you have malaria. You spend 20K treating malaria. They raise your leg, knock you here, power, shift the outside, knock you here. But they just look at her, give her simple anti-malaria, and her malaria disappears. Then after choking you up and down, putting you what you need and what you don't need, and the malaria is treated, her own is treated. Between two of them, which one is cost effective? She said which one is cost effective? Yes, her own is cost effective. The therapeutic outcome is achieved, but she spent more. Even though she is rich, her own is cost effective. This is what PAC targets. Am I communicating? So if after spending that, you keep sighing up and down, screwing your face like what I don't know. So someone that tested sour this thing. She's not satisfied. True or false? Yes. Now let me paint another scenario. Two of them, she went straight to PHC, and they look at her, carry out tests, and just give her maybe a card of artemether lumefantrine for malaria, and give her maybe other things for headache and fever and other things. Maybe at the end she spent 2,000 naira, and she will now come and say, I don't want to go to this. Charge me, and she now go to one chemist, and they miss one dose for her. That one dose maybe, and that dose may get one tablet of anti-malaria, get the different drugs and give her. She will take 500 naira. That day she will be okay. The next day again, she'll fall sick again. Then she'll go back again. They'll give her the second dose, and she will go home and take it again. By the time she will get to the next day, maybe after 2 days, she'll be okay. But the thing is not well treated. Then she will now start losing appetite and start having fever and start vomiting. She'll become weak. She'll become weak. And they will now carry her and go to that PAC. Or they may say this PAC may not be able to. They rush to one private hospital and give her a bed, set lines for her. Card is 2,000 naira. They will set line for her and start giving her at the end of the whole thing. They spend 30K and she's fine. Which of them is cost effective? She quietly went to the PAC as early as possible and took care of what she would have taken care of. But she was taking dose by dose. One dose. Now miss one dose for me. She will go. Are we together? So that's what we mean by what? Patient what? Now the next one is what? Help workforce Workforce. Workforce. Workforce density. And what? All this long grammar is having enough staff per unit of healthcare team you need per unit. Am I completing? And they are well distributed, not that they pack all doctors, all the pharmacists and put in one PAC. Then others will start managing nursing assistants and pharmacy technician. No, they are well what distributed. They will come in one. Hope you know that a government may have enough staff, but because this one is somehow, this PAC is in a somehow semi-urban area, they will go and they know how they now pack all of them, all the doctors, pack all the pharmacists, and put in one because that place is closer to their house. You know now they're all working there. Then there you see about. I'm giving instance. I'm not saying it's happening. I'm just giving examples now. You have about 10 pharmacists in one small PAC doing nothing. But there are other places that needs them. If you go there, you see one pharmacy technician, but they need pharmacists there. That's what we mean by distribution. So once you see that this thing is not the workforce is distributed, and they are not when they are not enough. When they are not enough is a different thing from when they are not what distributed. When they are not enough, it's a sign that the PAC is not working well. True of us, something is lacking. True of us, good. Then when they have enough, they're everywhere. As in they have enough, but they are not well distributed. It's a sign that some people or somebody is his way through. True of us, somebody is corrupt in distribution of what staff. True of us, somebody is taking into it. Yes, because they want a place that is in the what city. True of us, nobody want to go there. You go and say, Ogafa, I don't want to go there. Put me this way. Say, he said that he knows the person, the one I'll put through it. Or, Oga, please take this one and manage now. And let me just see what you can do. Just help me. Help your boy. See my house. You know, it's not about where you stay. It's about the importance we get. Yes, we know. Yes, if it coincides with where you stay, first of all, the first criteria is to look at where you stay. Hope you know. That's the first thing. But where they have picked maybe from the list they have a particular order, and they have picked those that you should be here, and you don't fall in there. You are not sure that to go to where you are posted. True of us, because you are needed what there. You put your head where you be 20, and sometimes you make work and be distant. Pressing food, be talking, and some person will working on two. Others will just be roaming the whole. Or when it starts, they just disappear. Whereas there's a place you are needed somewhere there. So that's what we mean by what? The workforce. So if the workforce density is low, it's a problem. If they are not well distributed, it shows a problem in the PAC. And it will eventually have everything going on there, because people will be having issues there. People will be true of us, yes. So that's the point. So that's what I mean by what the API of what the PAC in the what NHS. So now tomorrow you see yourself there. You can no. You can see you may be in position to make recommendations. You say no, something is wrong here. What the right thing. Yes, and of course, before you can do that, start from your maybe recruitment. You know that everything there is orderliness, right? True of us, or your name is arranged based on your score. exam based on your scores. Most times it's based on your scores. That is how they will now identify you, give you your own number. True or false? Then if they now want to put this for the time where you should work, that's the list they look at. So if they posted their what? Staff. Yes, it's on. If you check the list, you know that they actually follow the list. And you know that they need actually 5 sources here. And you've seen that you and them didn't enter that 5. Can you, if truly you love the practice, can you willingly accept where you are posted? That's the problem. Should we are shouting, you want to do writing? Can you, as a person, willingly accept? That's the problem. So we can never do well. We can never get it right. As a student, someone say no, sir. So when are we going to get it right now? Yeah, because of the ask. Ask.
You have many workers there.
Yes.
Work is more.
Yes.
But now the distribution is limited.
Hello, listen, please, start afresh.
Okay, in this case now, the workforce is, they have many workers.
Yes.
But the distribution, there is no way distributed or equally distributed.
Yes.
Can we say the problem of the PACN or
PSC.
yes. Problem or
Yes.
what they already do the workforce there.
Yes.
But the distribution due to the corruption of that facilities.
Yes.
This is the problem.
It's PSC. Let me tell you, who does the distribution?
Is it the workers?
Workers that work where? No, they work where? Whether it is those, whether it is sometimes the posting can be in a particular PSC. Sometimes it may be in the body in charge of the PSC. So why is in corruption or whatever, uneven distribution is the body that is in charge of PSC. Chase it there is not working with us. So PSC. Am I communicating? What did they in charge of PSC? Development what? Don't worry, we'll get there. Are we together? Hello? Is it clear now? I don't know if I answered your question.
Yes, I am.
Yeah. Because they're foreign bodies. They're not foreign bodies. Yes. Our problem day for our what? Shokoto. True of us? No. You day for our what? Shokoto. Yes. What we say? What you say no now because we are not, who said that? You. I know. You say no. See what they're doing. You say no. No. You're not listening. Hello. Alright, please let's continue. Now let's go to the next. The next thing is what? The 3 tiers of NHS. The 3 tiers. 3. Three tiers of what? NHS. NHS, yeah. No. The 3 tiers of what? NHS. All right. All right. You can put down the Nigeria health system. The Nigeria health system is structured into a 3-tier system. The Nigeria health system is structured into a 3-tier system. comma, each with distinct responsibility and rules. Each with distinct responsibility and rules. Distinct. How many of you got decision in your first year? Distinct. Sorry. Distinct. Distinct roles and responsibilities. Don't worry, I find out. You don't have to tell me. I'll fish you out by myself. Did you get distinction? Distinct what? Roles and all right. All right. The first one, number one. Tier one. Just write tier one. Put column. Then write primary health care. Tier one. Just like this. Tier one. This marker is showing black and red. What's going on here? The manufacturer red. You manufacture red and black. It's okay. So tier one, put in bracket PSC. Put in bracket what? PSC. The marker is just turning from red to black. Wow. Tier one, primary health care. Did you get distinction? Tell me. Did you? Did you? I'm not talking about the grace of weather. It's a question. Did you get yes or no?
Yes, and no.
No. It can only be yes. It cannot be yes and no. What? 3 point what? That one is not decision now. Decision start from 3.5, right?
Yes.
The decision start from 3.5, right? Yes. Okay, she's lying. I'll find out now. Don't worry. Let's continue. All right, let's continue. All right, so healthcare. All right, you can use one or whatever. Hyphen. Anyone want to do it? But right there. Provides essential healthcare services. It provides what? It provides essential healthcare service. Do you agree with me?
Yes, sir.
Primary healthcare. We are talking about we have primary health center, but we are talking about primary health care now. Okay? Hello? Because we talk about 3 tiers of the what? Health here. So it's primary health care. It provides essential what? Health care services. Do you agree with me? Yes. Then the second point is that it focuses on yes. It focuses on prevention. You look like someone that got distinction in your first year, did you? What happened? All right. It focuses on prevention, promotion, and community-based healthcare. Community-based what? Healthcare. So when we say promotion, I hope you know that we are not talking about promoting your advert. What are we promoting? Health, right? Good. Okay. The next point. The next point. No, stay on tier one. The next point on tier one. It is delivered through, you put colon. It is delivered. It is delivered through, you put colon. I want to list different ways primary health care is what? Delivered. Is it clear? I want to list different ways primary health care is what? Delivered to the people, to the community, right? I said it is delivered. Hello? This is son I just woke up from sleep. And it is delivered through a primary health care centers. Have you seen it now? It is delivered primary health care center. You see PHC. So PHC can be primary health care. It can be primary health care center, depending on the context. If you are discussing a place now, it becomes a center, right? Plus, if you are discussing what is being delivered, it's care. Primary health what? Care. Please don't get confused. Primary health what? It's delivered through a primary health care centers. Primary health care centers, you put PHC, then put S, small s. Is it clear? Through primary health care centers. Then number two, still under how it is delivered. Remember we are discussing how it is delivered. I mentioned primary health care. The second one is what? Community health centers. That one I told you about, you see some people, maybe a group of people that from a particular community that are based in maybe US or outside or abroad, they decide to come together. So some may build a community health center for people and they manage it by themselves just to take care of their, or they may partner with governments. Where the government, if they don't want of, can you tell me the most difficult thing to manage in this life? Let me use 10. Even though we are not 10, but I don't know how to put it. Difficult to manage is what? Human beings is difficult to manage. Even though those that go to church, even if that what regretted what? Creative. Human resource is the most difficult job you can ever do in this life. Manage human being. Hey. So sometimes they may not want the stress of managing to the staff. They may partner with governments and tell the government to send their staff where they are paying, where they will be paying them. They will be bringing the what? Salary. Yes, some do it. Or they may hire a company, a human resource company, to supply personnel and working there. Their own is to be bringing money for their what? Payment. Am I communicating? So that's what I mentioned. Community health what? Centers. If you go to some town, you see so health centers. Some of them are built by, but they partner with government. Am I communicating? Now, the next one is health posts. Health what? Posts. SC. Health posts. Health posts. The last one there is private sector providers. Private what? Sector providers. There are still private ones. Hope you know. Hope you know. Yes. That will be tailored in form of that health. They are tailored in form of the as. No. NGOs is different. NGOs that they're not Even though they may build their own, oh, they may build their own. It happens too. Some NGOs may just build such thing. And my computing where they fund it from money from donors. Some do it. Yes. Can you do what? Okay, who can tell us what health posts are? Who knows? Tell us. What are health posts? Who can tell us what health post is? Huh?
Where you position the cases?
Who can tell us? Where are my students here? Where are my students here? Tell us what is health posts?
Like movable health provider.
Can you listen? I continue.
Like a movable mobile health care provider that they can move.
Is it true?
Yes, it's true. That's what I mean by that.
Are you sure?
Health. When you talk about
Health posts.
like you can use private every weekend. Yes, there's an NGO that organizes people can call Ashra. So they have their own PBQ inside the same center that they can provide free education for people that subscribe to them.
Sorry. This weather is not weathering well on me. Who else has something to say? Health post.
Like a mini health center.
Okay.
Have as much as an health center, but maybe just like someone has a big injury and needs to be taken care of. Instead of taking the person to health center to take time, they're supposed to fix such kind of
Like first aid.
So they are not much there. Maybe to just be a pharmacist, a nurse, or a doctor, but they're not usually much in the health post compared to the health center.
Just to take care of minor
Minor
issues. Echo, yeah. Okay.
Then just be a shop. They do rent a shop to handle such a thing.
Okay.
So you go there, you register your name, and they give you first aid.
Yes, they can. I love this. That's good. But I don't know what is happening. Are you with us? Are you sure you're with us? It looks as if you are just physically, not spiritually. Please, let's be here in all ramification. Very important. All around what? All around what? Tier 2. Tier 2. Tier 2. Secondary care. In bracket SCH. HC, sorry. SHC. You see where I started to do? What type of miracle is this? Only on what is the talk to now? By the time I get here. Secondary what? Health what? HC. Okay. Let's continue. Under it, the first under it, it provides care. You know, it provides specialized medical care. Number 2. The next one says it focuses on diagnosis. It focuses on what? Diagnosis, treatment. and moments of we are talking about cases now, as a serious case now. Specialized what medical care, in diagnosis, treatment, and management of what cases of cases. Next one says. Next one says, it is delivered. Good afternoon, sir. It is delivered through right colon. It is delivered through the right colon now, just as we did in primary health care. It is delivered through colon. Under it, A, general hospitals. All these your general hospital you see around, they have secondary what? Health care. So by right, you are not meant to rush the room. Start from the one close to you. You are PHC first. But because of maybe something that PHC they play, something that PHC they play, two of us, something that PHC they do what? They play.
That's not always the main reason why people do. Sometimes there are serious cases of emergency.
No, remember what I said? I said hello. I said you go. I didn't say they rushed you. I say you go by yourself, not they rushed you. If somebody rush person first, go to start from, because if you go to primary, they may, before they could even you may not have what everything there to take care of that. It's a serious issue. Am I completing here? I'm talking about that you on your own, you safely somehow. You wake up and walk there. They may see you. You may think nothing. You may think that it's not something serious. When they examine you, they will now see that it's something serious. So they will now refer you. Am I communicating? But if it is, actually, if it is PhD that is working well, they may have all those things they need. When they rush a patient, they look at the patient first, but here sometimes you may go there, you may not even see the patient to even do all those things. I'm sorry to say about it, but it's true. In that case, the best thing is to do what? Go to at least from secondary. So it's true. Okay, you're waiting for them to write, then you copy. Is that what I've been doing here since? Are you sure? Okay. I understand now. It's okay. Copied. Now the next one. We are discussing how is delivered. Specialist hospitals. Specialist hospitals. When I say specialist hospital, you know what I mean now. In brackets, put things like maternity, pediatric, where you see specialist. True of us, yes. We have maternity, pediatric, whatever. I know any of them. All those ones are under what? Even though yes, you see the one you call maternity. Yeah, I say there's any class anyway. But you now understand what about specialist hospital? Are you serious? Wow, that's good. I like that. Okay. Good. Next one, district what? Hospitals. District what? Hospitals. Yes, see. District what? So everything concerning hospital starts, everything concerning secondary hospital start from secondary what? Healthcare. Are we together? That way start here. The next one says third Fear. Sorry, tier 3. Tier 3. Tier what? Hey, he's not completely black. Oh. Tier 3. No, it's blue. This one is blue.
That is your three colors.
Tier 3 color. Secondary color or tertiary color. Huh? Huh? Wait. So what?
Examples of district hospitals.
What is district?
District.
When you say district, what? Bring it home here. When we say this, what comes to your mind around here? Okay.
In a remote places now.
District should be something that overrules location.
Okay, town and district are they same thing? Is town under district or district under town?
Town is under district.
Yes.
So it's higher than what? PAC, right? Two of us. So short district may also have their own what? Hospital. So it's classified under what? Secondary what? Am I communicating? They may name it something else. Huh? No, there are some expressions you get by answering simple questions. You only know the answer. They said they were confused about this. I asked a simple question. Districts. So is describing again, and they didn't understand what I asked again. Towns and district. Which one is it? Town that is under a district or district under town? Let me see that. So town and district. Which one is under which? District is under town. I love this class now. Let's talk. Okay, someone says on here now that in a town you have about 3 districts. Is that what? Who will save us? Oh yeah. Me? No, I'm saving you. Wait, huh? Listen, please listen. Huh? So what?
We all go to our district office, which is the example. This measure is the district office to all Ikotu and Igodo, like they are all under Alimoshi. So we all went to district before district now channel us to different local government. So they are all under, even local government is still under one
District. Now, what is now under town? No, in that line of district town, what's now under town? Community is under town. Under town, are you sure? Under town. We explain to each other, don't worry. Under town, what and what can we see?
That's where we can get our health post under town. That's where we can get our community primary health centers.
Okay.
Under town.
Okay. Do you agree with her? Oga, are you with us? You look as if people should do this. Like, do this. Let me write down this and get away from here.
You don't get to
Okay, now let's start. States, right? The country, right? We have states, right? No, we have regions, right? Regions, right? Under regions, we have states, right? Then under states, we have what? Under state, we have what? How many senatorial districts do you have in Lagos State? How many? Under each of the districts, we have local governments. True or false? So, local government and district, which one is higher? Then she got it right. She said that when they are going for their posting, they went to their districts. From the district, they now posted to different local governments. From there to different communities, right? So do you now see why district hospitals are under what? Second. True or false? Can you not see it now? Does it make sense to you now? Let's continue, please. Tier 3. Tertiary healthcare. Tertiary healthcare, sorry. No, it can be a note. It cannot be a note. You can never, I reject it. It can be a note. I reject this thing. No, I reject it. It can be your note. You see, that's not your notes.
I'm using it as my notes.
So where are other ones you copied?
It's there.
Show me, let me see. Is it where we started?
I didn't come last week.
So what do you do about it since you didn't come?
The ones you thought is already counted. You thought components. So it's still loud.
Okay. All right. So let's continue. Number one says it provides advanced specialized and complex medical. What's time? To one. How many minutes to one? I'm waiting around 1:30. No, it's my time.
Are you sure?
11:30 to 1:30.
Okay, so it's true I have. Okay, sorry.
No, you pay me. Come, you pay for this. And complex medical care. Hello, complex what? Medical. I said it provides specialized, and complex medical advanced and complex medical. Second point. It focuses on referral cases. Note that point. It focuses on what? Referral cases and research. It focuses on what? Referral cases and what? Research. It focuses on referral cases and research. It focuses on referral cases and research. Have you done what it has to do? It focuses on referral cases and research. The next point, just as we have in others, it is delivered through A. Teaching hospitals. Hospitals. Teaching hospitals. Teaching is under what? Healthcare. Tier 3. Through teaching hospitals. B. Medical centers. So your FMC you see. FMC is under what? Tertiary. Federal medical centers. Federal medical centers is under what? Tier 3. Federal medical centers. Next one is specialist hospitals. Specialist hospitals. Yeah, the special hospitals. There are others. There are specialist hospitals that are under what? Tertiary healthcare. Yeah. Specialist hospital. Example: cardiology, oncology. Am I concreting? Cardiology, oncology. Many of them. Now, are we together? Now, I want us to look at after this. We look at the. Okay. What? I mentioned maternity. Someone talk about gynecology. So we are like they are, they are when talk about, they have a lot to do with also maternity too. But that not that they are. Hello, hope you know. Listen carefully. When I mentioned maternity in the is it primary or secondary? When I mentioned maternity, someone called gynecology. I said that they are related, she or two of us, but not all maternity issues are gynecological. Hope you know. Hope you know. So when you say gynecology, you are now becoming more specialized. Hope you know. Maternity is even though yes, it talks about female child, but it's somehow general in its own fair. It's also general in a way. Two of us, because under it you still see children, child, two of us, but when you now talk about gynecology, it's beyond just maternity. Two of us, that's why it can also be in tertiary. Am I concreting? As we have cardiology, gynecology, and the oncology. That's why we have consultants working in these teaching hospitals. These consultants, they will now have their resident doctors surrounding them. They work together. We call them what registrars. Two of us, they work with them because they are also under what training. Consultants are they work with what resident doctors that are under training. They pass the consultant. Two of us. Now this each of these consultants and their resident doctors, they are now specialist people. There are some that are in cardiology, are in oncology, some are in nephrology, some are in neurology. Some, God bless you. Some are in O and G, obstetric and what? Gynecology. Some maternity now. Two of us. I've answered that question now. Even though the person mentioned it, but it's more of special that third tier 3. Am I complete? Some are in gastroenterology. There are many of them. Some are purely surgery. Am I completing? So there are many of them. Also there. Some are in eye after what? Afterwards.
that they are really they are experts at, okay, like Navy now.
Okay.
You know, they have the nurses and doctors, they have the health,
Yes, yeah.
all these at least I watch military film a lot.
Okay.
So whenever they go on you see nurses will go with them, doctors will go with them. So under we should be taken, we put them, because these people are good though. You see them doing, people that got injured from battles or the likes, you see the doctors doing even things that normal doctor cannot do. The doctors will do it.
No,
Military doctors, yeah.
no, they are. The point is that the same training, the same curriculum is what they are also using. But the point is that they are under what? Military. They are on the line. They are in force. They are like, God bless, a family. Who said family now? Okay. They see everything is the same. Surgery is surgery everywhere. It's the same curriculum, but the point is that they are secluded in a way in their own, and they've done that for over. They have professors. They have they have these people. They are there. I'm not competing, but they are. How do I put it? They are soldiers or whatever. At the same time, they are doctors. Do you know why? Because of the nature of what they do. There are some. Let's assume now. Let's assume that there's war. Let's assume that there's war. Am I competing? A civilian medical doctor. A civilian medical doctor that has no military training may not survive. A soldier that is also a medical doctor can easily know how to, with his gun and whatever ammunition he has, he can keep shooting and be fighting. True of if it warrants, at least if nothing, they can defend themselves. True of us. But at the same time, they are taking care of the wounded. At the same time, some civilian, the hear of that bomb would some. Am I competing? Am I competing? Even though they still, they do what is called direct short services. True of us, they do that one. They may not actually, not all that train. There are some that join from class and grew in that line, study their own university, whatever it is, everything from there to the higher institution, and do all these courses. But there are some, those in the medicals, that they are more in the medicals. They put out adverts for they will not come. But those who that go, you also pass through military training. Hope you know. You also pass through military training. There are priests that are still military men today. True of us. And because of what they do, they prefer to do their thing in their own way. They also have their own pharmaceutical drug manufacturing outlet where they manufacture their own. They manufacture it and even distribute. They do their own thing, their own way, because their own life is. Ojo, okay. That name alone, I've not been there. I really don't know exactly what and what. It's not just the services. It's the services that you offer there that will determine where you belong to. Am I communicating? Yes. So I have not actually been there, so I wouldn't say. But I know it's not primary. It can be primary, but I'm still diving between specialists and what they have there. Hope you know. Hello. Hope you know that a place may even be as specialist teaching hospital but his secondary is under. Are you aware that you may see your assignments tertiary, what is it called, but it's actually by virtue of the services they can offer them. True of us. If you live a consultant, you may or may not see. I'm trying to point out something, that what defines a place is not the building or the name or the name they call it. It's service. That's why you may see a secondary. That's why you may see a secondary, a place that was established for just for secondary health care. It may be private or whatever. You see the services they offer there. Is the government decided that not say no, this place service here is more than just, please let's make it what? Tertiary. And just add one or two things and make it what? Tertiary. Because the management there took it so serious to make sure that they do the right thing in that place. And people, because of how serious they are, people keep coming and it's growing. And they actually reinvesting in making the place a bigger place. Government would look at it and say, no, this place doesn't need to be secondary. Let it be what? Tertiary. Because of what they offer. You know, we have leaders, managers, management that are foresight, that have foresight. There are people that are there. We have builders and we have squanderers. Are you aware? We have builders and we have what? Squanderers. There are set of management you bring here today. Give this place 1 year. This place will change. There are builders. It's inside. It's not. There are people like that. Then there are people you bring here. Give them 1 year. One department will close. Next one, this department will lose accreditation. They will close. Students will stop coming. And before what's going on, the school will close down. Just 2 years. So it depends on who and who are in the works management team. As establishment grows, some may start as just primary health care. Yes, there are some primary health care. There are some places that say as primary care, but today they are what? General hospital. And there are general hospitals that are started today. They are teaching hospitals. Am I completing? It depends on who and who is in the management team of that place. So it's what you offer that defines you, not what they say you should be. Am I completing?
Yes, sir.
What's time? What's time? 1:03. Okay, so in our next class, we look at hello, are we together? Are we together? In our next class, we start from the relationship. In our class, we look at the relationship between these tiers. What the relationship between them, this and this to this. That's what we look at in our next class. So please, give me like 2 minutes. Clear your desk. Bring out your quiz assignment quiz book. I said 40 leaves and above. Don't give me your souvenir. It's 10 minutes quiz. Don't give me your souvenir. Don't give me your primary school. All those exercise book your nursery 2 baby is using to learn how to write. I don't want that one. You say notes? No, please don't use your notes for that. I said it now. All right. See you in the next class. Please. It's not true. I'm coming back for the quiz.